Um, Good afternoon to everyone that's joined us. Thank you all for attending this session, Better Transport, Better Health and Wellbeing. My name's Jill and I work in Birmingham City Council's Travel Demand Management team. No doubt, like many of us, you've been getting used to new ways of working the last few months, including using Teams. So if there's any technical issues, please do flag these using the chat function and we'll aim to sort them if we can. I'd be grateful if everyone could put their microphone on mute and switch off their video so that hopefully the quality of our webinar delivery is better for everyone. This session is being recorded. If you have any questions during the webinar, please feel free to use the chat function and my colleague Mel will do her best to answer these as we go along, or we'll get back to you after the webinar if we need to find out any further information. Time allowing, Mel will also lead a question and answer session once the speakers have all finished, taking relevant questions from the chat feed. So, how are transport and health linked? Journeys are generally by car, and in fact 50% of all journeys made by Birmingham residents each day are by car, with others being made by public transport, including bus, train or tram, by walking or cycling. If you think about these different types of journey, in particular the daily commute, particularly how things were pre-lockdown, each of them is made up of different amounts of physical activity. For example, the car is the least physical active, with the driver hopping straight into their vehicle outside the house and generally parking as close to their destination as possible. Public transport usually involves a walk to the bus or tram stop or a walk and cycle to the nearest train station, and the same at the destination. Walking and cycling offer the greatest opportunity for physical activity and will generally offer a door-to-door experience. It's shocking to think that in Birmingham pre-lockdown, 250,000 journeys by car each day were of less than a mile. This not only adds to the level of air pollution in the city, but also means that people are missing out on an opportunity to exercise, which is beneficial to both physical and mental health. Over the period of lockdown, we will all have been made aware of changes that have taken place in the way we travel and the need for travel. At the beginning, the volume of traffic on the roads reduced dramatically as the daily commute for many disappeared, and we were advised to avoid using public transport except for essential travel. Initially, with the advice for half an hour daily exercise, many used this opportunity to walk and cycle, particularly in their local neighbourhood, even leaving the car at home to go to their local high street. I know where I live, although traffic levels have increased since the beginning of lockdown, I'm definitely seeing more people out walking and cycling each day. It'll be interesting to see how commuting journeys and local trips do change over the next few months, or maybe longer. We've got three people presenting today. We've got Carl Stott, who works for Birmingham City Council Public Health, who'll be giving us some key information about the values of an active lifestyle for our mental and physical wellbeing. Peter Edwards, who works in the Birmingham City Council Clean Air Zone team, who will be giving us some background and updates on the forthcoming Clean Air Zone for the city. And Rebecca Hawthorne, who works in the BCC Travel Demand Management team, who will be talking about the city's emergency transport plan. Right, so I'll now hand over to Carl Stott, BCC Public Health, Service Lead for Places.
Hi, thank you, Jill. Right, hopefully everybody can hear me okay. So I'm just going to start with my slideshow. So what I wanted to talk to you about today, as Jill has alluded to, are the benefits of a physically active workforce. I wanted to pitch it in this way because one of the easiest ways to capitalise on physical activity and improving health and well-being is through active travel, and one of the ways in which we can do that is through travel plans. So I wanted to pitch it in a way that hopefully would encourage both ourselves, and if there are any employers actually here today at this webinar, or if not, we have a lot of reach to employers, is to actually encourage employers within Birmingham to actually adopt a travel plan and to develop one. So that they can actually encourage their staff and themselves to participate more in active travel. So what do we mean when we refer to active travel? Well, it's as simple as the slide says. It's everyday journeys that we make to get from place to place, like cycling to work, walking our children to and from school, or walking to the shops. It's under our own steam as much as possible. There can be some breakages in that, in the context of as opposed to just hopping in your car and driving to your place of work and then staying at your desk all day and then driving home. It could be that you walk to your bus stop, maybe you walk a little bit further to the next one, you walk, you get off earlier, you walk at lunchtime, etc., etc. These things can be taken into consideration through an employer's workforce wellbeing program as well. And the evidence base on the link between active travel and physical activity is very, very extensive. And I've just put 2 hyperlinks in there that I'll let you explore at your own leisure once this particular webinar has finished. So how active are we? Well, it's not very good, to be honest. 1 in 4 women and 1 in 5 men in England are classed as physically inactive. That's doing less than 30 minutes of moderate physical activity per week. And as you can see, only 34% of men and 24% of women actually undertake any muscle strengthening activities at least twice a week. And the recommendation is that we actually do some sort of muscle strengthening activity at least twice a week. And men are more likely than women to be, well, on average, 6 or more hours of total sedentary time on both weekdays and at weekends. And I wouldn't just put that in the context of 24 hours, because that doesn't actually include sleeping. So if you think of the waking hours, that's only a period of time in your 24-hour day. 6 or more of those hours are actually spent in a sedentary manner. It's very, very bad for us, unfortunately. So what are the impacts of physical inactivity? Let's actually have a look at the cost of physical inactivity first, because I think this actually polarizes the issues that we have. So if we look at the left-hand part of this slide, we can actually see that 23.5 million working days were lost with reference to work-related ill health. That's 2018-19. We don't mean actual health-related issues at work necessarily. So we don't mean industrial accidents. We actually mean these are people that are either made, they're either ill with reference to general health and well-being, or some aspects of their work has actually contributed to them being ill. For example, stress, anxiety, musculoskeletal disorders from sitting for a very, very long period of time. On average, each person suffering took around 15.1 days off work. Predominantly, it's for ill health in general, 21.2 days for stress and depression or anxiety, and 13.8 days for musculoskeletal disorders. And physical inactivity directly contributes to 1 in 6 deaths in the UK. There is actually a causal link there as opposed to other. And it costs about £7.4 billion a year to businesses and to the wider society. We also have higher levels of absenteeism and presenteeism, and lower levels of productivity and efficiency with reference to physical inactivity and the impact that it has in the workplace. So absenteeism is one thing, so you may be off because you're ill, but also we see a lot of presenteeism, and that doesn't mean you're just turning up for work, but you're ill and you're turning up for work, and that means that your level of productivity and efficiency is a lot lower than it could and should be. So I just wanted to sort of polarize that a little bit and bring it down to a Birmingham level. So in Birmingham, if we look at obesity as one of our major issues, which we know is actually inextricably linked to physical inactivity, we can see that 24.5% of adults in Birmingham aren't even walking for 10 minutes or doing any cycling at all in a month. 25.4% of adults in Birmingham are inactive. That means they're doing less than 30 minutes of activity in a week. 12.3% of 15-year-olds are physically active for about an hour a day. That could be a lot more. And 18.4% of people who use outdoor space use it for exercise or health reasons. That's out of the whole Birmingham population. As you can see, though, there is a green ring there, and that is a positive because we actually have 571 parks in Birmingham. We've got more green space than any other European city, 14 square miles of green space. We have a lot of opportunity. We have a lot of access. We have a lot of networks, both cycling and walking. And we have, as everybody's probably well aware, a lot of canals as well. So the benefits of being physically active. Is it a miracle cure? Well, if it's good enough for Dame Sally Davis, who was the Chief Medical Officer until October 2019, it's good enough for me. Sally Davis actually said if sport and physical activity was a drug, it would be regarded as a miracle cure. And we also, that was in 2019, Hippocrates, who's quite often described as the father of medicine, he said in 430 BC, or is quoted as being saying in 430 BC, thereabouts, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we'd have found the safest way to health. That was in 430 BC. In 2019, the Chief Medical Officer is saying something very, very similar. The message is exactly the same. It is a very, very simple thing to do, looking at it in the broader sense, but clearly is very complicated at ground level because we are seeing less and less people being physically active. So that's a challenge, really. So what are the benefits of physical activity? We know that you can reduce dementia by up to 30%. We know that all-cause mortality can reduce by 30%. We can actually we can reduce cardiovascular disease by up to 35%. Cardiovascular disease and dementia being two of the biggest killers in Birmingham, with reference to premature death, dying before we should. Hip fractures by up to 68%. That's a phenomenal amount of hip fractures that we can actually reduce by being regularly physically active. And as we're getting older, we're working for longer. So it actually is important that we look at these things, because we quite often think of our workforce as being young, but we are actually getting older, and we're working for longer. We're being asked to work for longer, and we're physically capable of working for longer. We can reduce depression by up to 30%, colon cancer by up to 30%, breast cancer by up to 20%, type 2 diabetes by up to 40%. Type 2 diabetes and cardiovascular disease are two very, very challenging issues that we have in Birmingham. So here's a summary of the relationship between physical activity and health. You can actually see the evidence base. You can see the overall death rate with reference to the, sorry, I've just been thrown there by some of the comments. That might have actually been my children in the background. They've just gone out. The joys of webinars. So I'm not going to dwell on this slide because it's self-explanatory. You can see the health topic on the left. You can see the evidence of the effect of physical activity on it, which is quite compelling. And you can see the evidence for it. Much of this evidence has been around for a very, very long time, for decades. In fact, there was a very famous study done. I think it was in the 1960s, 1970s by a guy called Morris, and he actually studied the cardiovascular health of bus drivers and bus conductors, and he found that the bus conductors had far, far better health, and certainly cardiovascular health, than the bus drivers. They lived longer, they had better quality of life for longer, and they had less incidence of cardiovascular disease, predominantly because they weren't sedentary. They were walking around all the time. So that speaks volumes. That was a very famous study. So why promote physical activity at work? The workplace is where we probably spend most of our working hours, to be honest, during the week. So it's the ideal place to be doing it. So as an employer having a duty to look after the well-being of your staff, you can actually assist them in achieving the things on the left-hand side of this slide. But if you give staff access to the right resources and guidance, they can actually do it for themselves. So From a personal perspective, you can improve your sleep, maintain a healthy weight, manage stress, improve quality of life, reduces your chances of joint and back pain, which is one of the biggest issues we have with reference to absenteeism, and reduce your risk of major illnesses such as heart disease, type 2 diabetes and cancers. On the right hand side, you can actually see that a healthier, happier employee will in turn benefit your organisation. We know that sickness absence is reduced. We know that increased productivity happens. We know that we have lower employee turnover and higher staff loyalty, which is a huge thing, especially if you spent a lot of money training a member of staff up for them to actually then leave or be on long-term sick. And also higher morale as well, which is very, very important. There's two easy wins, two very, very quick wins with reference to physical activity. One is improving cardiovascular health, and the other one is improving mental health and well-being. Being physically active can have an absolutely phenomenal impact on your physical and your mental well-being. Certainly it can increase your self-efficacy, psychological well-being and self-esteem. Just one dose response of physical activity by up to 40%. Obviously you have to maintain that, but physical activity is one of the simplest things to do. It can more often than not be free, and the benefits are pretty phenomenal. So what are the recommendations? What should we be doing? Adults should be aiming for about 150 minutes of moderate intensity activity a week, in bouts of 10 minutes or more. So the good news is it can be cumulative. Gone are the days of the exercise prescription model when we were expected to do lots of prescribed activity 3 times a week for half an hour at a time, etc. Now we know the evidence tells us that we can actually look at a more habitual lifestyle approach. Bouts of 10 minutes here and there, moderate activity, cumulative to 150 minutes a week, will give us a protective health benefit. It can also be achieved by 75 minutes of vigorous activity if you want, across the week, or a mixture of moderate and vigorous. And we should be doing strength training as well, at least 2 days a week. And we should also minimise the amount of time spent sedentary or sitting. And that actually includes work. A lot of our work these days actually does include a lot of sitting down. What counts as moderate physical activity? Walking, gardening, hiking, dancing, cycling, swimming, and other moderate activities. So that list isn't exhaustive, but you can see some very good examples and some very simple examples. Even washing the car instead of taking it for a car wash, you burn a lot of calories, and you do a lot of compound exercises as well. So what can you do? And that is what can we do? And it is the royal sort of it's the collective. First of all, active environment. The environment does shape behaviour. Birmingham's a very car-centric city, very, very simple to get from A to B in a car. And for many, many people, it's a very, very, it's a default choice, to be honest. But we can change that, and we are changing it. We are reshaping our environment. Our homes, workplaces, local environments have been shaped to make it difficult to be physically active. But the most and the easiest forms of physical activity are those that can be incorporated into our everyday life, but walking and cycling. But our neighbourhoods, as you can see, have been largely designed around the car. Switching more journeys to active travel will improve health, quality of life and the environment. We really do want to take people out of their cars if we can and get them into a more active lifestyle, certainly for those journeys that are less or 1 mile or less. And we also need to look at pedestrians, cyclists and other users of modes of transport that involve physical activity. They need to be the highest priority when developing or maintaining streets and roads. And it can mean reallocation of road space to support walking and cycling. It can mean restricting motor vehicle access. It could mean introducing road user charging and traffic calming schemes, creating safer routes to schools. Lots of things that we've actually seen during lockdown that have been necessary. We've actually been able to test and been able to actually put in place. Also, improving or adding green spaces and tree cover does improve air quality, but I'll let one of my colleagues talk about that in more depth. What I can tell you is that accessing green space can actually reduce your cortisol levels quite considerably, and cortisol being your stress hormone. So the evidence tells us that just by being in a green space for 10 minutes or more, your cortisol levels will reduce quite considerably. So in other words, being around a green space is actually good for you. Small scale improvements as well can encourage movement, such as good street lighting or improved road crossings. The amount of people that I actually see and hear talk about either perceived or actual threats to safety in the context of, well, I won't go here because it's very poor lighting, or I won't go here because it isn't very well overlooked and it's quite restrictive. That can actually easily be designed out. So as an employer, 70% of the adult population are in employment. Strong evidence that the workplace, as we've heard, can be the place where physical activity programs are effective. So on the left, you can see the journey to work and home. An employer can actually look at flexible working policies and incentive schemes, policies to encourage employees to walk or cycle, for example, the cycle to work scheme. Information, ongoing advice and support, which is readily available through myself and other speakers. Independent health checks focused on physical activity as well. They can be popular because they can actually facilitate change, and they can also be preventative and have early intervention opportunities as well. And having a workplace travel plan, that's probably one of the simplest and easiest things that our workplace can do, is to have a travel plan. The work environment can introduce practical measures to include active travel, such as changing in shower facilities. So actually assisting in the facilitation of people being able to be active and engage in active travel. The strong evidence for the effectiveness of interventions to increase stair use. We know that 2 minutes of stair climbing each day can burn enough calories to eliminate the weight of an average adult gains each year. So there's many benefits, and I can't see any negatives, to be honest. It's a call to action for everybody. As you can see, health and social care commissioners have a duty. County sport partnerships have a duty. NHS and other public sector organisations, including ourselves, the council, have a duty. Local enterprise partnerships have a duty. The local authority, employers and community groups as well. We all have our part to play, and we can. Now, I wouldn't be public health without talking about coronavirus very quickly. And again, we have a duty to do that, and a duty of care. So what can you do as an employer? You can build workforce resilience. A fit and healthy population is a fit and healthy workforce. Unfortunately, evidence tells us that people who are overweight, have type 2 diabetes or other long-term conditions fare far worse if they contract COVID-19 than those who are a healthy weight and are relatively healthy and disease-free. And we've seen that nationally, and that the evidence is very clear. The evidence also tells us that the BAME community, the BAME population, is disproportionately affected by COVID-19. This is of significance to Birmingham because we are actually a super diverse city. And finally, the evidence also tells us that people are being less physically active than usual. But I do concur with Jill. I've seen more people walking and more people cycling locally, but from the surveys that we're doing in the city, the population is telling us that, generally speaking, people are being less physically active than usual, and that mental well-being is declining as well. COVID-19 will be here for a while, and there is no vaccine, and there is no cure at the moment. We hope there will be, and it will be here for a while with us. It's not going away in a hurry at all. We're actually preparing for a second wave, simply because we need the resilience in case we do get one. If you speak to people in public health, they're more of the opinion when will a second wave occur, not if a second wave will occur. And we need data, so please get your workforce to fill in the COVID-19 survey. You can play your part as an employer or as an employee by encouraging your workforce to reach the physical activity goals set out in the national guidance. You can encourage your workforce to quit smoking, because if you smoke, your outcome, if you do get COVID-19, is far more serious than if you don't smoke. You can do it through our Quit app, which is called Bella. You can encourage people to lose weight if they're overweight and maintain a healthy weight where possible, because we know that people who are overweight, again, are disproportionately affected by COVID. Developing travel plans for your workplace that will encourage active travel, which will reduce opportunities for transmission of the virus because you're not actually in an enclosed environment. And it can help your staff to improve their health and well-being as well. It's a real win-win having an active travel plan during COVID and encouraging active travel. It actually increases your physical and mental resilience through the very dose response of physical activity, but it's also removing you from scenarios which could increase transmission rate. For example, you may share a vehicle, or you may share public transport, or you may have to engage with parking facilities, touch handrails, touch parking, ticket machines, etc. We do stress that you need to follow the government guidance for COVID-19 in the workplace. The guidance is available. We will circulate it. We need you to follow the government guidelines for social distancing and reducing transmission. And also, if possible, and this is, if nothing else from today, if you could do one thing for me, fill in the public health COVID-19 survey. And there's a hyperlink to it there. So I think that's all of my slides. It is. So if anybody, are we taking questions at the very end, or how are we doing that?
Yeah, we're waiting till the end and doing them all together at the end.
Okay, I'll hand back over to you, Jill. Thank you.
That's great. That's great. Thanks, Carl, for a really
You're
interesting
welcome.
insight into how important an active lifestyle is for both our mental and physical health. And I never realised there were 571 parks in Birmingham, although I know there's loads of green space. That's really interesting. Right, now I want to introduce Peter Edwards, BCC Principal Clean Air Zone Officer, who will be speaking to us about the Clean Air Zone for the city centre. Okay, Peter?
Thanks, Jill. Thanks, Kyle. I hope you can all hear me all right. So yeah, as Jill has already said, my name is Peter Edwards, Principal Clean Air Zone Officer in the relatively newly formed Clean Air Zone team. So we came together as a team back in October to prepare to deliver and launch the Clean Air Zone, which hopefully you've all heard of. But following on from Kyle's presentation, I'll give a bit of background on why we need a clean air zone, then talk a little bit about what the clean air zone is, how it will operate, the kind of the logistical stuff, and then also talk to you about kind of what support there is out there in terms of supporting people who may be impacted by the introduction of the clean air zone. And obviously, hopefully everyone on the call is also aware that the clean air zone has been delayed, so we can talk about that. I'll just give a bit of information about that at the end, or we can talk about that in the questions. We'll just see how much time we've got. So as Carl's already touched on, and he's the public health expert, I'm not going to dwell on this too much, but it is incredibly important to point out quite what a blight air quality is on the citizens, on Birmingham citizens. So it's linked with up to 900 deaths a year in this city, all sorts of horrible diseases down the left-hand side of your slide there. Jill's already talked about the high volume of journeys by car in this city. And I think what I really want to kind of focus on is the fact that air pollution really impacts on the most vulnerable people in our society. So elderly people, young people, these are the people who are really being impacted by this, as well as actually, and similar to what Carl said, in terms of bus and taxi drivers, people who are behind the wheel a lot are actually the people who are suffering worse from this. There's kind of misconception in some circles that walking and cycling by a busy road is bad for you. Well, obviously you can be exposed to air pollution there, but actually the people behind the wheel are actually being exposed to more, and that is scientifically proven. So these are some of the effects. Talking now about the causes of this, and the causes of most of the air pollution. And when we talk about air pollution in the context of the clean air zone, we're talking about nitrous oxide. That's not the only type of air pollution, but that's the one that the clean air zone is in play is being launched to combat. And the primary source of this poor quality air is vehicles on our roads. That's around 50%. It's not to say that isn't the only one. You can see trains are included in that slide there. Planes do have an impact. Wood burning stoves have an impact, but that's more particulate matter. And what the clean air zone and what I'm going to be talking about is nitrous oxide, and that is predominantly emitted and caused by vehicles on our roads. The next slide goes on to talk more specifically about the fleet in Birmingham and issues and why we have such a big issue. So we've already heard that so many journeys in this city are short and they're done by cars. 83% of those journeys are in private cars. There's another kind of misconception that if we had less buses, or if we that we might impact on this. Well, actually, the bus is a much more efficient way of transporting people. Of course, we want cleaner buses, but it's this massive amount of private motor vehicles on our roads, and especially, as you can see here on the right hand side of the slide, the diesel vehicles that we need to reduce. So 46% of the emissions, the nitrous oxide emissions, are coming from diesel vehicles. That's nearly 50%, which is why, and I'll just touch on this in more detail, that the clean air zone restrictions are more restrictive for diesel vehicles. So the clean air zone is kind of the figurehead of a wider approach to improving air quality in this city. So the clean air zone is at the top, but there's a lot of other things going on across the local authority, as Kyle has already touched on and Rebecca will touch on in far more detail with the third presentation. But there's three main elements of what we as an authority are trying to do here. The key one there that I've already kind of touched on it is simply reducing the number of journeys, especially in these diesel vehicles and these short journeys, just reducing them. Where they can't be reduced, we want to, where you have to travel, and as we've already talked about, do we have to travel? We've all been working from home. Well, lots of us have been working from home. Do you have to travel? If you do have to travel, can we shift that journey to public transport, walking and cycling? And then finally, if that journey must be in a private vehicle, can that be done in a vehicle that is cleaner and is emitting less nitrous oxide? Now, that doesn't mean that it has to be an electric vehicle or a hybrid vehicle. The more modern a vehicle, the better the emissions from that vehicle. I'm sorry, I can hear my son screaming in the garden, so I'm just going to go and close the doors. Bear with me 1 second. You may not have been able to hear it, but it was very distracting for me, so sorry about that. So that's kind of what we're trying to do. This slide talks about Birmingham's transport plan, which is very much looking at reallocation of road space, prioritising those methods of transport that are more efficient and healthier for us. So as Kyle's already talked about, getting more people to walk and cycle, getting more people on public transport, because at least if you're going to the bus stop or if you're going to the train station, you're hopefully walking or cycling there. It has active travel built into it. Again, Rebecca is going to be presenting on this in more detail and talking about more specifically the emergency transport plan. So I don't want to talk too much about this, but this clean air zone is very much a component of a wider strategy for the city, which encompasses not just improving air quality, but health outcomes as well, and reducing congestion. So some of the things that have already taken place as part of the wider Brumbreeds programme, so the Clean Air Zone forms part of a wider programme. So last September, 6 car-free school streets were launched. So these are streets where motor traffic is restricted at pick-up and drop-off times. Just a couple of weeks ago, and a further 6 were announced. The feedback and on those first 6 has been very positive. So 6 more will go live in September. So that's again trying to protect the most vulnerable people, but also enabling people to to walk in a more pleasant environment. Their parents may not want to walk them there because it's a horrible walk to school. So though that's a really positive scheme. I think we've all hopefully seen that the blue cycle routes linking into the city centre along the A34 and A38. So a real step change in the quality of infrastructure, the best that Birmingham has ever seen. And Big Birmingham Bike Scheme, we've dished out thousands of bikes across the city. So these kind of additional measures to help support Birmingham residents make a healthier, more sustainable choice. So going on now to more the kind of the operational and the technicalities of the clean air zone. So the clean air zone is, first of all, is important to say, is not a congestion charge. Not every vehicle will be charged to go into that blue shaded area you can see on the map. That blue shaded area is all the roads within the A4540 ring road, but not the ring road itself. So when the clean air zone goes live, if you drive into that zone and you do not meet the compliance standards that you can see along the bottom of the slide there. So what that means is Euro 4 for petrol vehicles. So approximately vehicles from about 2006 onwards, if they're petrol, should be okay. And then it's Euro 6 for diesel vehicles. So that's about 2015 onwards. So in order to drive a diesel vehicle into that zone without paying, it needs to be a far more modern vehicle. The idea being that if you are driving one of those vehicles, you will perhaps not drive it into the zone, or you will transition to a different vehicle. So there is a charge levied against the non-compliant vehicles. So it's £8 for cars and taxis and light good vehicles, what we call vans, and £50 for HGVs, so that's lorries, coaches and buses. So any vehicle, once the zone goes live, that doesn't meet these compliance standards would need to pay those charges that you can see on the screen. It's important also to say that the charges run on a 24-hour basis. So you could drive in at 9 a.m, drive in and out as many times as you like before 23:59 of that night, and that's one charge. But if you drive in, let's say at 10 p.m. and then drive out at 2 a.m, that's potentially two charges. So that's just a little logistical thing that I often forget to drop in when doing these presentations. So it's quite an important bit of information. So it says there that we are a CAS D. It's important to note that not all clean air zones are the same. They are obviously tailored to the issues that you have in our own cities. So Birmingham has got a CAS D. Leeds, who will be going live approximately around the same time as us, have got a CAS B, I think it is, which basically means they're not going to charge private motor vehicles. But because of some of the issues that we saw on the first slide, Birmingham has taken the brave political decision, in my opinion, to charge private vehicles as well as buses and taxis and HGVs. So that gives you an incentive. That gives you an overview of how the clean air zone will operate, the charges, that sort of thing. Now, obviously, we're aware that this is going to be quite an adaptation for quite a lot of people. So we have applied for money from government to support the groups that were identified via our consultation as being the most vulnerable to these changes. So there are £15 million for taxi drivers, £10 million to upgrade HGV and coach fleets, and perhaps most pertinently to this audience, £10 million for a scrappage scheme for low paid workers in the city. So I will refer to them for the rest of the presentation as CAS workers. So that's somebody who works in the clean air zone for more than 21 hours a week and earns less than £30,000 a year. So they can apply to this scrappage fund when it goes live. It's not live at the moment, but it will be soon, hopefully. Sorry, I was just trying to change with my keyboard, but I can't do that. So this just gives you a bit more information about the financial incentives. We can ask more detailed questions about that or find that information on the Birmingham Brumbraid's website. I don't want to go into too much detail. This again is kind of specialist exemptions for things like emergency vehicles. Obviously, we're not going to charge ambulances and fire services for going through the city centre, and motorcycles are exempt. And then there are short-term exemptions, and again, this is probably more pertinent to the audience here. So people who live in the clean air zone and people who work in the clean air zone that meet the terms and conditions, they can apply for a temporary exemption to give themselves a bit of breathing room while they think about how they're going to change the way that they travel, upgrade their vehicles, modally shift to another type of transport. And then companies that operate within the clean air zone can also apply for the exemptions. And again, a lot of this information is, well, all this information is on the Brumbreeds website. Also to say that if you go to the Children's Hospital, Bathrow Medical Centre or Badger Medical Centre, then there will be like a voucher system for you to pick up a voucher and credit online if you drive there, so you won't have to pay if you're going to an appointment or dropping off a child at the Children's Hospital, for example. So coming to the end of the presentation here, this is a kind of timeline that shows our journey towards clean air. This unfortunately needs updating now because the clean air zone has obviously been delayed due to COVID-19. So the clean air, which segues kind of nicely into where we are right now. The clean air zone has been postponed due to COVID-19. So it cannot go live until the 1st of January 2021 at the earliest. So I'm not saying it will go live on that date. The exact date is to be determined, and we are hopeful that we will be able to announce that launch date before the end of the summer. So what I would recommend to you, and we could perhaps do this, I can perhaps put the link in the chat or something, is to sign up for our expression of interest form on our website so that you get a newsletter from us and updates from us. And the next one will likely be the new launch of the Clean Air Zone. So that is covered there, but as you can see, the Clean Air Zone is very much part of this and is seeking to transition people out of their vehicles either onto public transport, walking or cycling, or into cleaner vehicles, which will hopefully be aided by the emergency transport plan, which Rebecca is going to cover after me. So there's some contact details. We have a team mailbox that is monitored daily, so you can email us, cleanair@birmingham.gov.uk. I haven't talked about the vehicle checker. You can check the compliance of your vehicle on our website. It's right at the front of that page, and then there's all the usual social stuff there. So I think that concludes the presentation. I will go on mute now, and we take questions at the end. So thank you.
That's great. Thanks very much, Peter. Really useful update on where we are with the implementation of the Clean Air Zone in Birmingham, and obviously why we need the real need for less polluted air is so important to our health. Okay, so our final speaker today is Rebecca Hawthorne, BCC Principal Travel Demand Management Officer, who'll be providing insight into the city's emergency transport plan. Hand it over to you, Rebecca.
Thank you. I'm just getting back to the
Sorry, Rebecca. I shouldn't have stopped controlling, should I? I should have just.
No, you should let me take it. That's okay. We're back. It's fine.
Oh, well done.
So I want to talk a little bit about the Birmingham Emergency Transport Plan. People probably have heard various things about it, but maybe setting a bit of context and also giving a bit of update on where we are now, what we've delivered so far and what is sort of imminent in terms of delivery. So, as you say, you can't do it with the keyboard, can you? So we have a Birmingham transport plan. We have a draft Birmingham transport plan. Back in January, we were consulting on this plan that we'd written, and we thought, this is the direction of travel. This is the high-level strategy for transport in Birmingham. This is fine. We know what we're doing. And then along came COVID. We saw a lot of changes in people's transport, as has been mentioned. We saw more people walking and cycling. We saw an immediate reduction in the traffic and pollution. And obviously there was significantly reduced capacity on public transport as people were required to social distance and at the time to only use for essential journeys. So we needed to respond because actually there's a lot of transport issues there. It might not seem an obvious linkage, but there are a lot of transport issues. And also there's some opportunities there to sort of take some of that behaviour change that has happened for other reasons and encourage people to stick with some of that which is good, particularly the increase in walking and cycling. So the goals with the emergency transport plan, it's built very much on the framework of the Birmingham transport plan with the same or very similar vision, same sort of structure and big moves, and still aiming to address some of the issues that the Birmingham transport plan was trying to address, things like climate change, air pollution, as Peter's mentioned, in the clean air zone. Those are real emergencies that haven't gone away. We just have this additional emergency that we're working with. So we wanted to enable social distancing. That's important. Our footways are not necessarily 2 meters wide, and suddenly we need to be 2 meters apart from people. We want to enable pop-up infrastructure for walking and cycling. More people are starting to walk and cycle, but if they want to start venturing further afield, we want to make sure that they've got the facilities to make them feel comfortable doing that. And also what we want is, as people start to make longer journeys and start to think about how they travel sort of in the period we're in now, we don't want those people who might have been on public transport to say, that's kind of a bit of, I don't really want to use public transport at the moment, I'll jump in the car. We want to say, I won't use public transport at the moment, I'll jump on the bike, go out walking. And the other thing is, in May, the government were announcing various pots of funding available for COVID recovery, and we needed to be well placed to apply very quickly for those, because those were lots of quick turnaround and quick delivery on those. There we go. So those funding pots that are available to us, and we're now a little bit down the line. The Emergency Active Travel Fund was the main one that the government was announcing back in May, and that was to deliver these pop-up and temporary interventions for safe walking and cycling environments, and that's really quick turnaround. So on confirmation of funding, that's delivery within 8 weeks. That period takes us to about the end of August. So a lot of the stuff that we're wanting to do, there needs to be something on the ground by the end of August, and that's a really quick turnaround in terms of delivery of transport schemes. Of that, Birmingham's got just over £1 million to spend to do we applied for just over £1 million. The West Midlands as a region was actually awarded slightly more money than we asked for, so there's some ongoing discussion about how that extra is divvied up, but that's a really strong endorsement of the strength of the bid that we put in to government as a West Midlands region. The other funding that was immediately around is the Reopening High Street Safely Fund. Now, that's about business, that's about trading in public places, so it includes various things, but the bit that's of interest to us is money made available for measures in local centres and the city centre, so that people can do social distancing, queuing, that sort of thing that needed some changes to the infrastructure. The Emergency Active Travel Fund has a tranche 2 that is coming up. It's still relatively short-term funding, but it is not that immediate 8 weeks, and it's that we have yet to apply to, apply for. But that is about making some of these temporary projects into longer term, making some of these things permanent. The indicative allocation for Birmingham is about 4 million, but until we apply and we get the response, we don't know exactly how much we'll have for that. So the emergency transport plan, the vision, this is really, you can read this at your leisure, but really the light type was the vision that we'd put forward in the Birmingham Transport Plan, and there will still be a final Birmingham Transport Plan published. We're looking at the consultation responses still, and we're just a bit busy with the emergency one at the moment. But then with a few additions, which are the bits in bold, so that we're looking at the low carbon clean air recovery, stronger communities, economic recovery as well, and dealing with that more limited capacity on public transport, although also wanting to maximise the capacity there is on public transport. The Birmingham Transport Plan and the Emergency Transport Plan are structured around 4 what we call big moves, kind of 4 themes. The first of those is reallocating road space. This was something that Kyle talked about in his presentation. So we know that between 2 buildings, you've got a finite amount of space on that road, and it's pretty difficult to make that road any wider. But if you look creatively about how that space is being used, take away space perhaps from single occupancy private vehicles, you've got space there that you could use for cycling, walking, and now social distancing in some places, whilst also maintaining that public transport provision. What we did say for Birmingham in our strategy, I know some other places have taken bus lanes and turned them into cycle lanes, for example. We said we want to still maximise the capacity there is on public transport. That means that if we have bus lanes, we want to maintain them and look at putting in more even, because if a bus is not caught up in any traffic, it can get round its route quicker, it can carry more passengers because it's not taking as long to do each journey. So we're quite clear that public transport is still a massive priority for us, and we know that's also future proofing for as and when we come out the other side of whatever this time is. Transforming the city centre is an important strand, and in this case, particularly, this is around walking and cycling in the city centre, and I'll talk a little bit more about some of the things that we've done and how we've been able to bring forward some of the initiatives within the main Birmingham Transport Plan. Prioritising active travel in local neighbourhoods, really important. What we want here, and what we wanted in the main transport plan, is that walking and cycling is the go-to mode of transport for people in their local area. If you're going to the local shops, if you're going to school, then actually walking and cycling should be the first thing you think of, not an afterthought. It's the number one choice. And finally, managing demand through parking measures. That's a mix of things. Parking takes up an awful lot of space for what it is. So is on-street parking something that we want? Could we better reuse that road space and reallocate it? You know, do we need any other than disabled persons parking? Do we need any kind of parking space on street? I'll leave that open as a debate. But also we know that people's travel choices are very much influenced by the parking facilities at the destination. So if people know they can easily park close to where they're going, jump in the car, don't really think about it. If parking's going to require a bit more thought, a bit of a walk at the other end, then actually maybe it's quicker and easier to go on the bus, to walk, to cycle. So looking at how we manage that demand and encourage people to think differently about how they travel. So what have we actually been doing, and what are we doing? Space on high streets in our local centres. What we wanted, the goal here is really about social distancing and queuing, and this is where this high streets fund has come in. So we've been widening footways where we can to take out, often by taking out some on-street parking, which has met with various levels of local resistance. But one of the beauties of these schemes is that as temporary schemes, put them in and see how they go. If you know, if people find them difficult, will people actually adapt to them within a couple of weeks? What might they look like in local centres look like in future? But these are very much, you know, temporary materials that you can see there. We've got the barriers. So we've got top left is Sutton Coldfield, bottom is Kings Heath, the middle is Erdington, and the right is Northfield. But we've actually currently got 10 local centres plus the city centre in place or being put in right now, and more would basically, there's a review going on of every local centre to see what we can do, so there'll be more to be done. In terms of what the future holds for these schemes, they are temporary schemes, they are about social distancing, so in theory they come out when the crisis is over, but actually, as I said, this is an opportunity to see how people have used the space differently, and do people want that back? Have people preferred having more space for people, for sort of social activities, and a bit less, you know, cruising around looking for parking spaces? Be an interesting one to sort of watch this space on that one. The next thing we're doing is pop-up cycle routes. This is a massive part of the funding bid. So we've got 7 what we're calling pop-up cycle routes. By that we mean putting in light segregation, but on a temporary basis. Light segregation is where we're reallocating road space for cycling, and it's not the blue routes where you've got a full physical curb between the bikes and the general traffic, but it puts something in between them. So that might be the bottom right picture you can just about see. That's not Birmingham, that's I don't know where it is actually. You get these kind of pop-up plastic wands. They're a little bit like the ones that the same sort of thing that you bolt into the ground that we've got in Sutton Coldfield up in the top left there. Also what's called armadillos, kind of studs on the road, although those on their own can cause some problems with motorcycles, so there's some considerations to be put in. Although some of this, with so many local authorities doing this kind of work, some of it is a bit down to what materials you can get hold of, I'm led to believe, in terms of people being able to provide them in time. These routes that we've chosen, they haven't just been plucked out of thin air. Back in January, the council published our walking, cycling strategy and infrastructure plan, and all these routes are part of the strategic cycle network that we want to build as funding allows, and they're all also regional priority routes identified in the equivalent West Midlands documents. So this is great because, you know, if we can get people cycling now and continue cycling, there's massive health benefits. We don't want people to go back to their old habits. We want to stay with the new habits. And as more people are having to travel more now as we emerge, we want cycling to be a really good choice for people to make. Places for people then. So this, if people are familiar with the jargon of low traffic neighbourhoods, that's what I'm talking about, but don't worry if you've never heard of that. This is about looking at streets where mostly residential neighbourhoods and about reducing the amount of traffic, basically so that if you can cut down the amount of traffic, it's a lot nicer to be outside, it's safer to walk and cycle, there's space, you feel confident to let kids go out and play, neighbours can chat. So what we want to do is take out rat running traffic and really just have that local traffic so that residents can still get to their homes by their car or park relatively nearby, can still get deliveries, but we don't have through trips through an area. We keep those kind of on the main roads. People worry that that pushes more traffic onto the main roads, but actually, if we make these environments nicer to walk and cycle, you can reduce the levels of traffic overall, because those local people are not making quite so many trips in their cars. I think there's clear massive health benefits to this in terms of the physical fitness from being able to walk and cycle more, in terms of the improved local air quality from less traffic, and the better mental health and well-being that comes from living in a safer environment with less traffic and stronger communities, because it's a much more conducive to people talking to their neighbours and having that social interaction in that space. So this absolutely is the sort of thing that Kyle was talking about, where he sort of said, you know, neighbourhoods are designed around the car. This is saying, let's take what we've got, but redesign it with some relatively simple measures to try and make that different kind of space. And the way we want to do this initially, that comes in as those temporary measures, the sort of, so the left hand side is a street in Lozells, which is part of one of our two project areas, Kings Heath and Lozells, that we'll be working in initially, and turning it into something a bit like on the top right, where you put in something physically in the road that means cars, it's sort of a point closure, cars can't go through, cycling and walking they can, but it just stops that rat running through that area. You can also do things like one-way streets, you can widen footways, but what we're trying to do is sort of talk to the people in the community, albeit on this very short time scale, to get their feedback about things that we can change. Because these are temporary measures initially, it's really good. You can say, actually, you know what, that's not working there. Let's move it a few hundred meters down the road and see how it works down there. And you can start then to evolve the area to use the space differently. And then in the future to say, yeah, this is working. This is what we want to put in. These are the bits we want to make permanent. And you've kind of shown people how this can be done along the way. And you can also then see how this might be replicated elsewhere in the city. So some exciting couple of projects there. In the city centre, and I apologise, I've realised it's 2 minutes to 3, so I shall try and hurry up. Some of the things we're doing have already been mentioned, measures to help social distancing. Some of that pop-up cycle route infrastructure either starts in or is within the city. What we're also doing is talking to business organisations, particularly the business improvement districts, about how the public realm can support business activity, sort of outdoor hospitality space. Nationally, it's being made a lot easier to apply for pavement trading licence, but you do still need to make sure you've got that 2 metres clear of footway outside properties. So we're looking at more things we can do. Again, things like suspension of on-street parking might be something. I mean, the top right, the right-hand photo there is a parklet that Southside Bid put in a few years ago, but it shows the sort of thing that can be done if you take out 1 or 2 parking spaces. The middle image then, this is what we want, something that the Birmingham Transport Plan introduced as a new concept for the city centre. That area, you'll note, is the same as the clean air zone area, the map that Peter showed you. But one of the things we want to do is try and reduce the overall traffic in the city centre by stopping through trips. So the idea being that you divide the city up into sort of, I think we're referring to them now as quarters, even though there aren't 4 of them, which bothers the mathematician in me, but I'll move on. And the idea being that private vehicles can drive into any of those quarters from the ring road, but can't move between them. If a private vehicle wants to move between, it goes out to the ring road and then back into the other. But within those, cycling, walking, public transport can circulate freely and much more safely, because there should be reduced traffic then to do that. Obviously, also potentially some reduced traffic from the clean air zone itself, as people choose to make trips in different ways. Full introduction of this isn't in the scope of the emergency transport plan, but there are things that we're now finding we're able to do sort of through the emergency transport plan to sort of lay some of the groundwork and put some of the initial work in. And hopefully that's just an indicative map that's there, but we're hoping in the next couple of weeks to be able to release something that reflects all the hard work that's gone on behind the scenes about more detail about how those areas might work and the city centre might work. And just some other things that come into the scope of the emergency transport plan, because there's so much going on at the moment. The e-scooter rental trial comes in. That's being led by the West Midlands overall, but hopefully we'll have one of these webinars coming up soon, actually, that will be on the subject of e-scooters, how they work. It's all sorts of new legislation in terms of how they're working on the road and how people will be able to hire them for use in Birmingham and some other cities as trials. School streets, Peter mentioned our car-free school streets initiative, and we've got more schools coming on board with that in September. There's also a whole host of other things we've been doing to sort of support schools over the years with their travel plans, and also now, you know, offering us support as the schools are looking to reopen, and if there are sort of traffic management changes that would support them in doing that in September, then seeing what we can do to help. Park and pedal, we're looking at spaces where people might be able to drive part of their journey, but then if they're coming in, say, to the city centre, they can maybe park up. For example, if the station at Selly Oak car park, not so much capacity on the train, but very close to the blue route that we have, and will be linked by some of this pop-up infrastructure. Park up with the car on the bike on the car, hop off, cycle into the city centre is better than driving all the way into the city centre. Also looking at other ways we can support cycling and encourage it. The West Midlands have just launched their Roll and Stroll campaign. There's a picture there of that on the right, which we hope will encourage, again, people to keep going with the cycling and walking, and to give it a try if they haven't. Support for workplaces. I've not mentioned travel plans very much, because Kyle did a great job of selling the benefits for us, but one of the things that Jill, Mel and I from our team can support businesses with is putting in place a travel plan. We've got an online system that makes it very simple to do that, so really love to hear from people who'd like to get their business involved in that. And the other thing we're doing is we're just reviewing all the currently proposed schemes that are on the table at the moment and saying, are these in line with the emergency transport plan and the main Birmingham transport plan and the principles that we've set out within that? Are there things we can do to make those even better for particularly active travel and also public transport? So a few places to find out more. We have a page on the City Council website that's got we're adding to as we go along, but information about the emergency transport plan. If you've got any feedback on the local centres initiative, Sustrans are coordinating that for us through their Space to Move map page, and we're also imminently, in the next day or so, going to have a Commonplace website. That's another means of engaging people and getting feedback and collecting suggestions that people may have. Whether we'll be able to implement them, I'm making no promises, but particularly around the COVID measures. So that will be very soon. By the time I circulate the slides, I'll probably be able to put a web link in there. So thank you. I apologise. I've now taken us to 3 minutes past 4, but we might be able to do just a few questions if people have got maybe 10 minutes to stick with us. Thank you.
Okay, that's great. Thank you, Rebecca. Really helpful. There's just a couple of extra slides on the end here that are talking about what you can do next as an organisation. So basically, both Kyle and Rebecca have mentioned travel plans. Really important thing, particularly for businesses. We've got a lot of schools signed up to do travel plans, but we really want more businesses across the city to engage with us. So there's information there. I mean, it'll be senior management team, sustainable travel or health and wellbeing officer that would take charge of that at an organisation. And then, as it says here, we just want we'd appreciate if you looked at the facilities your organisation actually has and see if there's anything that you feel is missing that would help somebody actually take up cycling or walking to work in the future once lockdown's finished. And then, yes, so next slide is just a list of resources that we've put together. So there's some links to things that can help. It's not an exhaustive list. There's other things that are out there that can help you. Okay, so that's great. So I don't know if there are any questions that have come in that you want to talk through.
There's only the one. I think everybody was completely engrossed in the really interesting presentations, as I was actually. Really good, thank you. So just the one which Peter's probably read on the chat actually. It's a clean air zone question. So it says, clean air zone, I live just right outside the zone. My car mechanic, my GP, my dentist is within the zone. What does that mean for me since I drive a 2000 reg car? Peter, can you?
Yep, hi. So my immediate response would be, if you live just outside the zone, could those journeys, obviously not to the mechanic, but to the other journeys that you mentioned, could they be walked, cycled or used public transport? With the mechanics one, I guess that you have to take the car there. And at that point you would, unless you work in the clean air zone and you could apply for the clean air zone workers exemption, at that point you would have to pay the £8 fee to go to your mechanics. And then the other option is to change your car or upgrade your car. But as I said, clean air zone's not going live just yet. So there's a number of options there.
Thanks, Peter. There is another question now come in. Is there any scope for increasing secure covered cycle parking similar to the Selly Oak Cycle Hub? This sort of structure could really help increase cycle use. Rebecca might be able to help respond to that, but I know that there is a grant at the moment through Transport for West Midlands, but it's not for covered cycle parking. But if any organisation does want to add or upgrade their cycle parking, there is a grant at the moment for free cycle parking, so that's worth looking at. We can send you a link to that anyway. Covered cycle parking or a hub. Anything you want to add, Rebecca?
Yeah, sort of to say that the at the moment the emergency transport plan in terms of cycle parking says if we can get some more cycle parking at destinations, that would be a good thing. I think probably though that would be more the quick sort of Sheffield stands, which is just kind of the metal kind of arches thing that you attach to. But I absolutely hear you in terms of the things like the pod at the stations have been really popular, and it's certainly something we'd want to look at what we can do in future. Sorry, that's a bit of a vague answer, but it's a yes, we agree they're a good thing. No specific plans at the moment that I'm aware of.
I just know from experience from my time in my last role that yes, they are great things and we should be looking to put them in, but it's really difficult to get people to take over the maintenance and who manages them if they get broken into. I used to work at the University of Birmingham, and we were desperately trying to get one, and we couldn't come to an agreement with the neighbouring hospital, even though we were big organisations. So it was really tricky. Rebecca was probably party to some of that. So yeah, just to say, really, it's frustrating, but they're hard things to get in with planning permission and all sorts of other things.
This is where if you have the power or can lobby your workplace, as Mel says, that applying for that funding that's available at the moment is well worth doing.
Okay. Is that it on the question front, Mel?
I think so, yeah. There's just a couple more people saying thank you, so thank you. There's also just one more. Expanding the blue route is also important and needs to continue. Yeah, completely agree with that as well.
Yeah, what I didn't quite say when I was talking about making those temporary measures into permanent measures, the real difficulty on that is the blue route's absolutely fantastic, but their cost, don't quote me on this because I could be wrong. I think it's roughly £1 million per kilometre. They are not cheap to build. So even when we go to that permanent infrastructure, there's a balance to be struck there in what we can do to the standard of the blue route. Do we do a short section to that standard, or do we do a longer section as a kind of incremental process to make it, more permanent but still a bit more work to do? And it's a difficult choice to make because we need that magic money tree. But they are absolutely the standard that we want to be building to wherever possible now.
Okay, is that it on the question?
That's all the questions, yeah.
Okay, so I'd just like to take opportunity to thank you all our speakers for giving up their time today to take part in the webinar, and Mel for pulling it all together. Also like to thank all of you for giving up your time to listen to what we've had to say. I just think the overall message is that although we do all need to travel, whether for work, leisure, utility trips, perhaps we need to think of the most appropriate way of travelling. So we not only help to improve air quality in the city, but it will also have beneficial effect on our physical and mental health. Okay, so thank you all for attending, and that's it from us.
Thank you for the opportunity.
Thank you very much.
Yeah, thank you.